Welcome to Let's Get Real to Heal. I'm Dr. Joelle Samaha, founder of Life Wellbeing Education Center, an adjunct faculty, author, and researcher in the field of philosophy of health and well-being. Through my work, I bring philosophy, emotional healing, and holistic techniques together in order to help clients reconnect with themselves, release what is no longer serving them, and connect with the spark of life, philo life, love of life. This podcast is part of the Let's Get Real to Heal campaign. Here we explore the wisdom of philosophy, the science of well-being, and we share real stories of resilience and transformation. How much of you could be stored in your own body? In today's fourth episode of our campaign, we're going to be speaking about the pelvis and the emotional content it could store. I'm honored today to introduce you to an expert in the field and a friend. Welcome, Dr. Jameela.
Thank you.
I'm really happy to have you on board, and I hope that the podcast will roll spontaneously and that we could bring, the information and the tools people would be looking forward to learn, I'm sure. So let me just introduce you briefly. So Dr. Jameela holds a PhD in emotional pain sciences, and she is an assistant professor at the Global Structural Integration Institute. She combines different modalities and technique, and she's known as being a holistic physiotherapy, and we're going to see why. At the same time, she is a Rolf advanced practitioner. And Dr. Jameela combines different modalities, different holistic modalities in order to help clients heal on a physical and emotional level. Tell me, Dr. Jameela, what and how do you do things differently?
So previously, as you know, Joelle, I was working for a government setup, and it was a 700-bedded hospital, and I was dealing with ICU patients mostly, rehabilitating them from GCS 7, And one fine day, I wanted to contribute more to the society. And I came across something called structural integration, which is a very deep emotional pain sciences as to what could be the reason of your pain. Like people come with back pain, knee pain, but there could be an emotional content behind that pain. And I just started diving into it, and it took me to my PhD. And now that I've become a co-founder of my own course, which is called the Emotional Content of the Pelvis.
Yeah, I'm really excited to speak about this today. Yeah. And your 20 years of experience, whether it is in the ICU or rehabilitation or supporting women with their well-being, how have you observed the connection between the emotions and the physical expression, I would say, through pain?
Yes, that's a very good question, Joelle. So what happens is, because we, somewhere in the medical fraternity, we start looking at humans into parts, like, the cardiologist would look at the heart, the nephrologist would look at the kidneys. But as a physiotherapist, you have to look at the patient holistically as a whole. And these emotions, the trauma of, say, childbirth, the trauma of abuse, say, the trauma of neglect, all this can be saved in our fascia. Fascia is like a huge network of, it's like a sheet. Imagine that, your organs are wearing clothes. And this fascia is like a covering, which covers the entire body. So I had one client or one patient who was complaining of toe pain, and suddenly not taking enough treatment for the toe pain, it started becoming his hip pain or his lower back pain. And it was very intriguing to see why a pain that far would lead to something like back pain and severe back pain. And when we were treating his back pain, we actually realized just doing a toe correction, the back was already getting or feeling better.
Better, yes.
So that is when, it kind of struck me that the whole body is a dense network of fascia. And our core or emotional content, which is maximally saved in our pelvis. And if you have heard this, my gut feeling, Where is the gut? And who is the gut?
Exactly.
So I came across, while treating so many clients and patients, I realized that the gut was nothing but a muscle. It is a muscle which is part of our pelvis, which connects our pelvis to the hip joint, and it's called the psoas. And it helps you to store a lot of emotions. And this gut cannot be manipulated. It cannot be sedated. It cannot be, tricked.
That's interesting to start with. We've all heard about the pelvis, but what is the pelvis and where is it located?
So if you notice, the gym goers call it the core. The anatomist would call it the connection, and the physios would like to call it the center. But so the pelvis is nothing but the center part of your upper body and lower body connection, where the two bodies, the upper and the lower, meet. If you look at it from a different perspective, it is also the connection, because it holds our umbilicus or the navel, which is also the connection or our origin or the point of contact with our mother. That was the only connection that we had, with our mother when we were in the womb. So it is the center of our existence.
Yeah. So when you speak about the pelvis, I heard you mentioning that the psoas is inside, or the gut feeling as well would be inside the pelvic area.
So when I think about the pelvis or the pelvic cavity, I just don't look at it as a pelvis or a bony structure. I look at it as a vital center of my being, because I've got my digestive system there, I've got my excretory system there, I've got my reproductive system there, and I've got, that was the connection of my origin with my mother. It's got the gut feeling, the love feeling, and psoas is a muscle which connects. It's a two joint muscle basically, which connects the whole spine to the legs. So you can call it as a connector.
It's a connector.
Yeah.
I think that we are hearing a lot about the psoas more than the pelvis. Can you explain us why do we consider that the psoas is storing the emotions rather than speaking that the pelvis in general holds it? Or, correct me if I'm wrong, is it the pelvis that is storing all these emotions?
So pelvic is like a container, like a basket, where everything is kept. And psoas is a very tiny muscle, but if you look at its facial connections, it's got the connections of the fascia connections, which is like the sheet or the cloth, with the diaphragm above, okay, which is our breathing muscle, to the uterus or the reproductive organs of the male below. And it is anatomically positioned in such a way that every time the first step you take, where you move your leg, you start moving the psoas first, because it's a hip flexor. So you start taking the first step. The moment you put the first step, that's the muscle that that's the muscle that will be in action. And alternative medicine believes this, that it stores a lot of emotion, and it could be the gut or the second brain. I would like to see it as the brain of my body. Like I have a brain, and then my body has its own brain. Mm-hmm. And this mind-body connection that we are actually talking about, it could be this connection. Whereas, I want to feel safe. I want to feel loved. So let me ask you a question, Joelle. Have you felt fearful? Extremely fearful?
That's what I wanted to tell you, that obviously when I visited you in 2018 and I had a massive jaw issue. I was in pain. I couldn't open my mouth because of the jaw pain. I remember that at that time, I have not realized that most of that anxiety and fear I was carrying it out of fear in that area.
Yeah.
And then I started realizing after we've done a couple of sessions that it is true when I get startled or where something happens, I tense these muscles within first.
Yes.
I think we speak more about neck, about shoulders, but less about the amount of pelvis muscle tension that we can create when we are under continuous stress.
So you notice that love is felt in that area, fear is felt in that area.
True.
Sometimes, have you noticed that you would want to go and buy a beautiful apartment and it's on sale and you're getting it on a crash price, and you've entered that space and suddenly you have not wanting to buy that apartment because you just did not get that safe feeling.
True. That's what we call usually our
the
intuition or the gut feeling.
So all that is coming from our pelvis.
Exactly. So how do you know that someone is storing emotions in the pelvis, or if the pelvis is showing symptoms which are purely physical?
So pelvis, I mean, it's not that someone may be storing or not storing. We are all storing at every given point in time. Our life experiences, we are storing it somewhere in our pelvis. The problem is our body only recognizes or listens to pain. And pain it can be in form of knee pain. It can be in form of back pain. Sometimes, like you came with jaw pain, because the pelvis has again shown connections with the jaw. And if you look at the alternative medicines or the pain sciences, they say that our jaw and our pelvis, bony alignment are very similar. And they are both ball and socket joints. So they are all placed on one top of the other. The TMJ, then the shoulder joint and the pelvic. So these are the ball and socket joints which are placed in the midline of our body. So the connection can be neural, musculoskeletal, or the fascia connection, which we already know about.
Could it cause infection, like urine infection?
Sometimes, yes. The patients come with frequency of UTIs, urinary tract infections. And, the doctors are trying to figure out why they're getting this, and they're being put on antibiotics, a lot of other therapies. But if you just do an emotional release of the uterus or the urinary bladder, you will realize that the frequency of UTI is coming down. Because again, urinary tract infections are a sign of fear or a sign of worry.
So how do you assess a client who comes to you? Usually I would say people who choose to come and see you are suffering from some physical pain. That's why we go to a physiotherapist. Now it's becoming more and more common to hear, like, I'm coming for an emotional release because I feel some tightness here and there. But years back, we would not hear of this at all.
Yeah, so still, thanks to the clients now, because of the word of mouth, I'm getting patients who are well aware that they want to get an emotional release. So that side of my work has kind of reduced. But if a patient has come, so one thing that now that has happened is I don't get a client who would come for the first time for physio to me. You would have gone to other physios who would try to address your back issues in, other ways or modalities. And finally, somebody would have told you that, why don't you try Jameela? And then when you would come to me, I would assess you. I would do a thorough assessment as to why your back issues have not been resolved with regular physio. Or,
At this stage, what's different in the way you extract information from the client? Do you only assess the physical aspect of it, or would you ask more questions about, how they feel? What is their level of stress? What is going on in their life? Because I think for introducing this concept, it must be sometimes clients would say, like, why would she ask questions about my childhood, about my current life? So how do you do it? And how much can we spread awareness about that if a physiotherapist doesn't ask about other aspects of your life, it's not a holistic approach to health then.
So when the client comes, after doing the physical assessment, you definitely have to dive into all those questions as to if they are married or not. And if they are married, do they have children or not? And if they have children, did they have normal deliveries or not? Then what were their challenges in delivering? And if they are not married, then what are their challenges? And, do they have a specific reason to choose to not marry, or, whatever route they have tried to take in their life? And then what do they think about their parents? What do they think about their childhood? So I throw random questions like, tell me one childhood memory. And I'm just trying to assess if it's a good memory that they are having, or, something that is like the first thing that comes to their mind. So if I would ask you, what is your childhood memory? Some people would remember playing in the sand, or playing in the grass, or, swinging, something like that. But some people would remember getting beaten up, sitting in the corner and waiting for their parents, or, because they did not do the homework. And some teachers who have been rude or mean to them. So it depends on what memory they come out with, or what memory they are saying. Then I keep, my questions are based. So it's not like a format that I have. It's a very, very subjective and individualized treatment format, where every question is very individually driven.
Yeah.
Sometimes intuitively, sometimes, looking at their body's appearance, or, assessing them, it kind of tells me if they are in a threatened state. So then, asking them what they think about themselves.
So it's beautiful, because the underlying philosophy to it is understanding that the body, the pain, the physical aspect is just a way for the body to communicate that there is some imbalance happening for quite a long time. And I would say that ignoring these symptoms would lead to an aggravation of the situation if we do not acknowledge. So what I like about what you just said is that you are acknowledging that pain and honoring that pain and trying to understand what is that pain trying to communicate for the client, so you can help personalize a format, as you said, or modalities to help them heal at a deeper level.
True. Because I have understood over a period of time that I'm not a doctor or a philosopher. I'm only a translator. You just bring your body to me and I translate what it wants to tell you, because it is only talking in pain. But why you are suffering from that pain could be because of a lingering emotion. And, it could be from a spouse, it could be from your parents, it could be validation, it could be fear of letting go. And sometimes I was just reading a recent research, and they said sometimes pain is the only way we remember the other person. So we don't want to let it go, because those painful emotions could be the only format or the memory that we have about them. And if we choose to let go, we will have to let go of that person. And maybe our emotional system isn't ready to let go of that parent or the spouse, or, a wrong relationship.
I agree with you. In fact, as a life coach as well, I've observed, because I work with clients who have health issues like fibromyalgia and other conditions. Yeah. And I do make sure that the client is not blocking their own healing, because this is mostly linked to who they are, or to the type of affection they can get out of the condition itself. Yes. So definitely it's more than just a symptom, for sure. And I remember as well, Jameela, at that time, I've done a few sessions to release my jaw after being to many doctors. And I've been diagnosed with TMJ issues. But at the same time, it was a painful process to release it. Like that, to share is like, really having the finger inside the mouth, and it's gross. But at the same time, the release I would get afterwards was unbelievable. And I would remember that while your finger is trying to release that muscle, which is really sore, you would be telling me to breathe in and to breathe in deeper so you could release. So the whole process was a process that was not only physical. I was letting go of certain thoughts, of a certain resistance. And I think I lived this beautifully. And after that, I was fine, if you remember, for many years. Then I think a year ago, I came back telling you, okay, I tried to sort it out on my own because I tried to learn the technique and, speak to myself. But at the same time, sometimes things are overwhelming around me. And I think the first thing that comes in is my jaw. And then again, you released it and I was able to maintain. And this is where I realized that health and well-being is a continuous journey. So when clients come to you, they should expect not only a diagnosis, not only an emotional reading, but a release process. And I think people who are watching us today would be excited to learn and know more about how do you release.
So it's a very... I don't want to call it painful, but it's a liberating process. Because whatever I'm doing, I have gone through on myself as well. Yeah. And so I remember when I started structural integration, like as a therapist, I mean, a naive, just a mother who was leaving the kids and going and, abroad and studying and wanting to learn more. I remember I had this urge to look at the phone and, to be connected and be available for my kids. And my professor, he told me, he said, these hours are about you and you won't get them back. And out of sight is out of mind. And, your kids will learn to manage. And initially it was very difficult for me to understand this. But then the release started happening in my body, I realized that I couldn't become a better human if I was not a better Jameela.
Yeah, definitely. We need to work on ourselves continuously. And I would say, because I've observed it with clients as well, that we can have a weak point when it comes to processing emotions and stress. Yes. Some people do get more of a feeling of pressure in the chest or acidity if it is in the digestive system, or lower pain or shoulder pain, etc. So spreading the awareness that a recurrent muscle tension is not an enemy. It's just an indication that we are overstoring in a certain area of our body. What would you say about this, and how to give guidelines for people to know when do they need a release and when do they need to wait?
So our journey, so like we always call it, it's a journey. There is no destination to this journey. It's a constant process. And you will realize that you need releases. The pain cannot always be physical. Sometimes the emotional pain is going to be like acidity. Suddenly you realize that, your acidity levels are frequent, or you are having frequent burps, or you are having flatulence, or you are having incontinence. Yeah. Suddenly, out of years of childbirth, and now you have suddenly started having incontinence.
Yeah.
Or your moods are low. All these are signs that you need to visit a therapist who can help you release the stored emotions. Because we always need to empty the bucket. The bucket is going to get full. I mean, because you're humans and we are always looking for validations. We are always looking for people to connect with, and so we are always leaving some bit of us somewhere, and somebody is leaving some bit of them in us. Yeah. So we need to constantly get ourselves. So first thing is to be aware about ourselves, and then realize that, okay, now I need a release.
Yeah.
So the initial session is to create the awareness that, okay, now this is where I want my body to be. And then watching ourselves that, okay, I don't like this person's energy, or when this episode happens in my life, that's the time when I hold my breath, or that's the time when I have a urine leak, or that's the time my acidity goes high. So it's a learning process for the clients as well, where they are understanding what they don't like.
But Jameela, listening to you, I'm also thinking about the fact that most of us nowadays, with the way we hold the phones and we sit on laptops, etc., we kind of have neck pain or back pain or one or the other. So I would say, like, usually knowing that this could be the source, sometimes we would ignore it or try to go for a massage or try to stretch or do stuff like that. But when is a physiotherapist would be needed?
So for the neck pains and back pains, if you have severe neck tensions and back tensions, then you will definitely go and visit a physiotherapist anyway.
So when it gets intense.
When it gets
and
intense.
It's not resolving.
It is not resolving with whatever you're trying at home, the hot packs and the stretches and, the exercises that you have been given, or, your postural corrections. You're doing all that and it's not helping you.
Yeah.
With the neck pain, I really recommend that patients or the clients should watch if they are holding it in their jaw. Like, are they clenching the jaw while they're talking?
Yeah.
Are they tightening their jaw muscles?
Exactly. And I think people who would seek a holistic physiotherapist would know that they are coming not only to fix whatever is hurting them, but to release. So how much do you feel your clients are cooperative when it comes to your guidance for releasing emotional components from the physical aspect?
Yeah, so now what has happened is, thanks to the social media and the awareness that is already circulating around, people have started understanding that it is much deeper. They don't know how deep or where it is, but it is much deeper.
That's amazing.
And it's like, you're peeling the onions. So you have to go layer by layer. So when you come to me in the first session, I'm not going to release your psoas, because psoas is really deep.
I do remember when you released it, and it's deep and it's also felt and it is structural, and it's not a simple
Yes, it's not a simple thing. So you have to prepare the body. So, and you have to make sure that the breath is open. So you would release the breath first. Mm-hmm. And then, you would open the cavity. You would open the viscera. Only once the lungs are open, there is enough oxygen coming in. Because if the blood supply to our abdominal cavity is huge. That's why, if you have ever encountered with bullet injuries or, stabbing wounds, the patient does not die because of the stab or the bullet. It's because of the profuse blood loss.
Jameela, I wanted to know more about that connection you mentioned between the jaw and the pelvis, and how much can we store trauma in the pelvis that can radiate into the jaw? Because I think logically, when you're scared, when you're out of alignment, you store in the jaw, right? So how are these three connected: jaw, pelvis, and traumas?
So we cannot say who came first, okay? Because the trauma could be from the pelvis, depending on what type of trauma you've had. If it's a sexual abuse, if it's a physical assault, or if it's difficult childbirth, or a very painful journey of pregnancy, or a fear which was instilled in your body at a very early age, then it could be coming from the pelvis. But if you are in an environment where you're constantly suppressed, submissed, you're not able to raise your opinions, you're not able to put your point forward, then that is coming from trauma, coming from jaw. Because that is like, your emotions are not being spoken about. It's like, you must have heard that saying, very wise person has said that, swallow your anger.
Swallow your anger. Gosh.
Yeah. So why would I swallow it? Because I can't spit it out.
We hear it quite a lot, but thinking about it, aggressive.
Exactly.
Aggressive, and feels quite impossible when you hear it.
Yeah.
But then
And sometimes even if you see when people get angry, they go, oh!
So you store it here.
And then you store it there.
So usually when we speak about tension and the jaw, it is lots of anger, lots of words unsaid, lots of words
and emotions and lots of feelings of, maybe it could be of love, of anger, of fear, of anything.
Exactly. I agree with you totally. And then that is a reflection.
Exactly.
We don't know in which order it goes, but definitely it's the link we're focusing on in terms of resolving on long term the physical symptoms and the traumas. Because some people work on the trauma itself. But even after doing many sessions of whether it is hypnotherapy or life coaching, etc., sometimes they do need that physical release because the body has absorbed so much for a very long time that it's no longer only, just emotional. It has also manifested on the physical level.
Yes, but I would like to correct you here that it is not sometimes that you need a physical release. I think most times you need the physical release because you can only release the trauma that you're aware of.
But this is where I'm telling you that I don't need to refer every client to see you, despite that they would be having physical issues. Sometimes just because it's an emotional thing. So just with hypnotherapy, with different modalities, trauma therapy, etc., the whole physical pain is gone. Whether it is fibromyalgia or something else. But we see in lots of cases, especially in extreme ones where there is abuse or where there is a history of being bullied, etc., that even if the child or the teenager or the adult has understood and is aware of the causality and the trauma, etc., they have stored it for so long that it became a habit for the body to tense those muscles. So how do you deal with these cases, and how do you teach the body to relax?
So that's the thing. The first few sessions where you tell the body that they are safe, they don't need to be in that tensed situation to feel safe. Because sometimes the body only learns, our body is a pattern. Okay, so we learn the pattern, or we teach our body a pattern of feeling safety. Mm-hmm. So then we have to reteach the body this, that, it can be safe if it is let go on. So then the muscle spasms will start to come down in frequency. The panic attacks would start to come down in frequency.
Exactly. When I healed from those symptoms, it was gradual. The intensity reduced first, then the frequency reduced, then it was all gone. And that's with
then you also start to
approach.
Understand which are your aggravating factors.
Yeah. And I think it is important. And I mean, we are lucky to be part of the STEPS program founded by Dr. Javed Hingora at Dubai Homeopathy Health Center. In fact, for the clients or people who are watching us who don't know about that, Philo-Life Wellbeing is in collaboration with Dubai Homeopathy Health Center, working on treating cases in a holistic way. And we do combine holistic physiotherapy with the reflexology, with homeopathy ultimately, and life coaching, sharing the details, etc. So the release can happen at all levels. And I think when I had been through my anxiety in 2018, it was with the help of different holistic modalities, because clients asked me, is it possible to come out of these situations, of these conditions? And I'm like, if I'm out of it, then obviously that's the only thing I can be sure about, that I was able to. And today we were driving here and you were telling me, in 2018, if we were late for the shoot, you will be, in a different mindset. And I smiled about it. It's really funny because I really was able to evolve and get to a space where I don't live in fear anymore and where I surf and flow with life. And this is because of that opportunity. Yeah. So this is where I want to highlight that despite that many times in the files we get commonly, we can see the self-limiting belief, we can see the trauma, etc. But it's only when they go to you and using your fingers, you're able to release certain blockages. And this is where I'm again highlighting the breathing part, because I know that when you work, you focus a lot on your breathing.
Yes.
And I do remember as a client of yours and as feedback from my clients that usually it's their breathing allowing you to go deeper with the
Yes.
release. So can you speak briefly about it so that, people get to know that this exists? Because I didn't know that this existed a few years back.
So breathing is such a beautiful process, Joelle, that we have taken so lightly. I mean, if I may say so, it's a privilege to breathe, and that too at a subconscious level. Imagine if the divine would have designed us in such a way where we had to breathe on a conscious level. I mean, I would not be able to do anything. I would not be able to talk. I would not be able to go to the washroom. I would not be able to do my work because I would be constantly thinking, oh, I have to sit and breathe. So breathing is put on a subconscious level. And there are so many books written and are, the ancient scriptures which highlight about breathing. And if you notice, the childbirth is nothing but, breathe in and take a deep breath and then push and then breathe in. And so if you see, everything is connected to breathing. When a client gets panic attacks, we ask them to breathe.
Exactly.
When you are in fear, we ask them to breathe. I mean, such a normal sentence we say, relax and take a deep breath.
But with the muscle tension, it is amazing that the more you breathe when you're pressing, the deeper I could feel your fingers
So the
going.
because the more you breathe in, what you do is you allow me to come in, because with the conscious effort that, yes, I don't need this pain anymore.
Yeah.
And breathing just kind of, it's again liberating. Like imagine, you being locked in a small suffocated room. After some time, the only thing that you want to do is come out and take a deep breath in fresh air. And that's exactly how your muscles feel.
Agree. And I think feeling it, because I'm the advocate of you need to feel the pain, honor it, understand it, and then transform it and allow it to leave your body in a very safe, honorable way. Because again, this old approach to dis-ease, like lack of ease, is just portrayed in the fact that whatever dis-ease I'm feeling in my body is just helping me understand that I need to release, I need to let go. Most of the time is about releasing and letting go in different ways. So this is where I would say that when we ask clients to go to you and feel their pain, how do you approach the pain? Do you teach them that this is a pain that you need to acknowledge first and allow to release? Because many clients go in a cycle. They fall into a cycle of the pain, causing fear, causing anxiety, more muscle tensions, and then again they are stuck. They come in a panic.
Yes.
So how do you help your clients to come out of
So what happens is, first you kind of understand where the patient is. So if I want to bring him to my level, I have to go to his level first. So I go to his level, and whatever he's telling me, he's got back pain, he's got knee pain, then I try and understand what is the functional limitation pain giving him. So if they cannot bend enough, or if they cannot sleep well, or if they cannot eat well, or if they're saying that I'm not able to do an activity properly. So we try and focus on that first, and then we get confidence that, oh, this is happening now, I'm feeling much better. And then from there we slowly direct the body, and we give the body this idea as to why does it want to stay in a threatened environment. What does the threatened environment give them which the normal environment is not giving them?
Exactly. So this is the importance of combining physiotherapy and physical emotional release with life coaching or hypnotherapy or other modalities in terms of making other changes in the environment and the way you deal with the environment, so that we can maintain the results. Otherwise, the body will tense again. And this is not a surprise. I mean, people do complain about it as again. But the thing is, what have you changed for it not to come back again?
So, but even my patients, they come back with saying that, oh, it went back. And they are very aware afterwards that, oh, I went to this place and recently we had a case where, this patient would keep coming with heart palpitations. And after digging in a lot of history, we found out that, okay, it was his ex who left him, while she left him, she did mention or say a lot of abusive words to him, which left him very shattered from inside. And he didn't know how to come out of that. So we were on that journey, and he was doing so well. When he went back to his home country, he went to that house where he and his ex used to live, and he could immediately feel that his muscles are getting tightened up. He did not panic. He tried to do his self-release techniques which were taught to him. He tried to breathe in and, relax and do everything. But then he came back and he said, you know what? I know what my trigger is. And that is what the whole concept is about. I can't protect you from not getting triggered.
Of course. And what I like is that you teach tools, like with my sternocleidomastoids, because this is where I tense first. You've taught me how to release it. And this is what I like, that it's not only a physiotherapy session. But since we've been talking about the pelvis all through, how does physically the pelvis release happens, like on a physical level? Like, do you release it physically with your fingers? What do you use to release it, and is it a long process to do?
So pelvic content release is divided. I like to divide it. Okay, I would do it. So it's mostly the organ release and the muscular release.
Okay.
So when I'm talking about the organs, it could be the reproductive organs, it could be the excretory organs. So mostly in women, I like to release the uterus. For men, it would be their reproductive organs.
So the pelvis can be released for both men and women?
For both men and women. I mean, it needs to be released for both men and women, because we are living in a very man-driven society. So the male abuse is not so much out there in society, but I'm very sure that there is a lot of male abuse happening.
And it's not only abuse that can be stored, that it could be just, feeling disrespected at work by his boss, that could lead to all that tension. Or him having done something that he is feeling guilty about, and that could be trapped in that area, sometimes causing impotency or other issues.
Erectile dysfunctions. It could be, feeling the feeling of not being enough or not being a man enough.
Exactly.
And so, these are such words or terminologies which we just use, out of nowhere. But it holds a lot of emotional connections.
True. So you release it, you were just saying that you release it in steps.
Yes, so I release it in steps, and I make sure that I have prepared the body. I make sure that the client and the rapport is at a level where they can approach me at any time, even after the session is over, because it's not one size fits all.
Yeah, for sure.
Right? Your release and my release would look very different.
But it's always a physical.
So it's always a physical release, but the release is done physically. It's a manual therapy, where you would go to the organ, anatomically locate the organ, and, get into the facial connections, and, ask the patient to connect with their breath and feel those organs with you, because the awareness has already been created in the previous sessions. And then you are trying to help them release those organs. And then at the same time, you're asking them if they can think of an emotion which is connecting to that organ. And if they are if they've had a miscarriage, sometimes, so I have had 2-3 clients who've had miscarriages, and when I'm releasing their uterus, they can think about the child that was missed, or they have thoughts of them. And later on, if not during the release, after the release, they've had dreams of those children, or, those fairies.
Yeah, everything is connected. It's unbelievable.
Yes.
Yeah.
I had one client, very surprisingly, Joelle. She was so confident because she had a uterine cancer, and she had undergone hysterectomy where they had removed the uterus. And she was very sure that she wouldn't have any issues with me releasing her uterus. And I was like, but it's going to be deep. And she's like, yeah, there is no uterus, so I'm fine. But you can't believe, Joelle, she did not come back for 3 months for sessions. She did not leave her house. She was scared of driving.
Oh.
She was, and then we had to go back and convince her and bring her, because she was in so much of denial. And all that came out.
Yeah.
So it's not like the therapy, it is going to take you to places where you have not been.
Yeah, it could take you to places where you've not been. And it is possible that from the first few sessions or first session that you're not able to go as deep as you would like, then you would call, I guess, the client again
Yes.
for another session. This is why it becomes a process for releasing.
Yes.
And the thing that the pain is reflective. So as you said, it can start in a point and it turns out that the source is somewhere else.
Yes.
And this is, again, something that I've learned with time, that it could be like I'm feeling a headache on top of my head, but the point where it all started is
your lower back.
Back or the
shoulder
shoulder
blade,
blade. So yeah, this is more of an awareness to spread, that when you consult a therapist, they can help you locate the initial reason for your pain, and they help you release it on an emotional level if they are trained
Yes.
for emotional release therapies. Dr. Jameela, I'm really grateful for your presence today and for this beautiful conversation. I hope we added information and knowledge to anyone who would choose to watch us in this podcast. Is there anything you would like to say before we wrap up for today?
I would like to say that consider your gut as a very precious thing. For the moms to be, I don't know if you've heard this. This is a very cultural thing. Maybe in India, our parents would always tell us, if you're pregnant, look at good, beautiful things. Think about beautiful thoughts.
Yeah.
So your thoughts and your ideas will become your body, and your body will become your pattern. And you will start storing those emotions. So just be aware of things that you like, what you don't like, and are you storing them? And start bubble wrapping yourself, your inner self, because it's a very trespasser's zone and everything should be prosecuted.
That's beautiful. That's beautiful. So I would say, remember, healing can start where you least expect it. It could be in the silence of an organ. It could be in a pain radiating in your body, or just in stories you've been holding on to for a very long time. So in this campaign, Let's Get Real to Heal, we need your support. So follow us on all our social media platforms, from YouTube to Instagram and TikTok. We are banking on your support to keep providing information and to keep providing tools to support the holistic approach to health. So together, let's get real to heal.